Questions from our participants, and I wanted to start with, as a physician, what do you consider some of the risks associated with being overweight or obese?
Well, some of them are very common and everyone knows. You're worried about, and some of them are less common and people don't know as much about it. But being overweight puts you at risk of diabetes, and diabetes is a disease that affects blood vessels, nerves, and everything throughout your body. It can decrease your life expectancy. It can cause you to have high blood pressure, so your blood pressure can go up because you're overweight. It can affect your bones.
How does it affect your bones?
Well, there's a couple ways that it does that. One is causing more arthritis. So even 5 pounds of weight gain can actually give you arthritis or put you at increased risk for arthritis. Mostly in your weight-bearing joints, so your knees, your ankles, your hips. But you can also have problems in your shoulders and your elbows as well. Thank you. You have to edit that.
We're not working good at it.
And then mentally, it's not very, for people who are very obese, mentally it's not a healthy status, because most people know if they're very obese that they're not healthy in their weight.
Right.
And so mentally it's also not helpful, and you increase your risk for being depressed because of your outlook on your own body self-information.
Well, you mentioned some things I think probably most of us are aware of: diabetes, high blood pressure, high cholesterol. Are there some things that people may not know that are going to be impacted when you are overweight or obese?
There probably are, so I don't know if everyone knows about the arthritis components. There's the good part is it to our knowledge, it doesn't increase your risk for cancer, so that's wonderful. But as far as arthritis, your overall well-being, maybe people don't know as much about that.
Right.
And you should be aware that those are also negative impacts of being obese or overweight.
One of the things we commonly hear is people come to a weight loss program and they get really frustrated when they only lose a half a pound in a week or a pound in a week, because if you have 20 pounds to lose, they really want to lose 2 to 4 pounds every single week. Can you speak to why the medical professionals think that losing a little bit over a long term is better than losing a whole bunch at once?
Mostly because we know that the people who gradually lose weight are more likely to keep it off.
Okay.
And you would prefer to, if you're going to lose weight, you prefer to keep the weight off.
Right.
And if you do a fad diet or something quick where you lose a whole lot of weight, a lot of people gain that and more back. And so that's the primary thing. We know that making a lifestyle change or a life change to make yourself healthier is a big step.
Right.
And you need to do it for the rest of your life.
Right.
And doing that, making those changes, typically end up in having a small amount of weight loss gradually, the same way you gained it. Most people didn't gain their 20 pounds overnight.
Right.
They didn't gain it in a month. They gained it over a year. I mean, some people may have gained their weight over a month. And the ones that gain their weight over a month, if they lose it over a month, then they probably will be okay.
Okay.
But most of us did not gain 100 pounds or 20 pounds or 50 pounds or even 10 pounds in 1 month.
That's a really good point. So is there a magic number? I know some of us get really, people come in, maybe they have 50 or 70 pounds to lose, and they feel like it's overwhelming to try to think about losing that amount of weight. Is there a percent that somebody should aim for where we know that maybe their risks will be a little bit less, even if they never lose all of the weight that they need to?
Well, if you lose 5 pounds, you'll make a big difference as far as your joints are concerned.
That's
so your risk of arthritis goes down even with a small amount of weight loss.
That's wonderful.
Most of the time I tell people, don't look at your big picture first. Make some small goals along the way. And so depending upon how much overweight you are and what your ultimate goal is, you might want to start with, say, I want to lose 5% or 10% of my body weight, and give yourself a reasonable time to lose that 5% or 10%, depending upon what goals you have
Right.
overall. You want to make it in smaller increments so that you get encouraged by the steps that you've made. So when you lose that 5 pounds, you're excited.
Right.
And you should be excited, because if you're making lifestyle changes to lose weight, then you should feel good about yourself for doing that if you're doing it in a positive manner.
Right.
And a pound, you almost have to lose almost 4,000 calories for a pound. So that's not a little bit.
Right.
That's a lot.
Right.
And to make those types of changes over a short term would be extremely difficult, but you have to do something extremely drastic as well, and that's not usually sustainable.
Okay. So if you had a patient who came in to see you and say they lost 10 or 12 pounds over 10 weeks, would you say that they had done a really great job?
That would be an exceptional job.
Awesome. Good. Because we have a lot of folks in the boat who've lost between 5 pounds and, say, 12 or 15. And I think they see that number and they say, well, I still have a long way to go. So you as a physician would say, however, that they've done an excellent job.
You've done an exceptional job. Wonderful. And you want to keep up the job. So you want to give yourself a reward and say, oh, look, this is wonderful.
Great.
You've done a wonderful job.
Right.
And then start again like you're starting afresh and say, hey, I'm going to start and have a new goal now.
I like it. That's good. I wouldn't have thought of that. In terms of overall health, a lot of times we think about exercise just as a component of weight loss. What are some of the benefits of exercise alone, not including the weight loss stuff?
So we know that people who are the same weight, even if they're overweight, the one that exercises is healthier than the one that does not exercise. And we know those people who are borderline, or those people who have normal weight that don't exercise at all, are actually not as healthy as someone who might be a little overweight that does exercise.
Okay.
And so no matter where you are in your life journey, or your battle with weight, or you don't have a battle with weight, exercise is really important. It helps with your well-being. The brain is healthier. You stimulate better receptors and things in the brain, all the way down to prevention of cancer. So exercise prevents cancer.
That's amazing.
Prevents you from being overweight, prevents cancer. You know, we always look for that miracle thing that does everything, and exercise is sort of what it is. And typically what we should do is walk more, exercise more, and that would actually make a lot of things better. So better for your joints. It's better for your joints in more than one way. It decreases you're less at risk for having arthritis if you're doing some exercise, but then you also have more bone growth and more bone response when you exercise, and you're doing some resistance with it. It helps you, prevent you from gaining weight, which decreases your risk for gaining for bones. But even exercise by itself helps prevent against diabetes. It makes you utilize your pathways better, and utilize what you're doing with food better. It helps speeds transit through the gut, so it gets more of those toxic chemicals out. You have better bowel movements. I mean, it runs the gamut of the things that exercise does for you.
So if you had somebody who hadn't been necessarily successful but had incorporated more exercise, would you consider that to be a positive thing?
Yes, absolutely. And they should, if they can keep that up for their, the recommendation is that you get at least 40 minutes of exercise most days of the week. So you're talking about exercising 4 to 5 days a week for 30 to 40 minutes every single time you exercise. And so if you were not doing that and now you are doing that, that is also something that you should celebrate.
Good. That's awesome. We had another question from one of our participants, and she had said, do you have any suggestions for staying on track over the long term? So she has previously been successful at losing weight over a short period of time, and like most of us, struggles with keeping it up over the long period of time.
So as you mature, you lose muscle mass. And doing nothing actually will lose more muscle mass than if you're actually doing some exercise. So another plug for exercise, right? Lose less muscle mass.
That's a good thing.
Muscle mass at rest, you burn fat because of the muscle mass that you do when, like, we're sitting here doing nothing. Maybe we should have actually been doing this on a walk. But we're sitting here doing nothing, and a percentage of muscle mass is burning the fat that we might be burning at this seated position. So someone who has more muscle mass is going to burn more fat at rest like we're sitting. Okay? And so over the long term, you want to maintain or try to maintain muscle mass. But to maintain muscle mass, you have to do more work to maintain the same muscle mass.
Right.
So when I was 20, I'm not the same muscle mass as when I was 30.
Right.
And if I want the same muscle mass as 20 at 30, now I have to put more time into resistance exercises to maintain that, right? Which is why we talk about resistance as a component of your exercise. You don't just want to be doing aerobic exercise.
Right.
Getting back to the point that she asked, what can you do to maintain? Because she's interested in making sure she maintains the weight that she's already lost.
Right.
Well, one of the things you need to do is pick something that you enjoy. I mean, if you don't like what you're doing for your exercise, it's going to be really hard to keep doing it.
Right.
Don't overextend yourself. So you have to carve out the time that you're going to use to do that part of exercise. And so it has to be valuable. It has to be a value to you, to your family, to whomever encroaches upon that, your exercise time, your job, whatever it might be. So you need to make sure you're making changes that encourage that positive behavior and to avoid situations and environments that might discourage you from being successful in those areas.
Awesome.
Along with doing something that you absolutely enjoy, that you can look forward to doing, so that it's something you absolutely want to do.
And then this wasn't one that I had, it was some of the I had written down, but one thing I hear a lot of times is people will start later. So I'm really busy right now. I don't really have time to make a change, whether that be exercise or trying to lose weight. What would you say are a couple small things that people can do even if they feel like they don't have time to make a big commitment?
So the Surgeon General, the current Surgeon General made a pose to people to walk more.
Okay.
And said, he mentioned in one of his talks that what if we changed the culture and said, instead of let's go get a coffee, let's go have a coffee or a tea and meet.
Again, we should be walking right now.
Let's just go for a walk, and why not have this meeting while we walk rather than having this meeting in a room? And he said, he said that he doesn't even drink coffee, and yet he still said, let's go get a coffee. He said, so why don't we all say, let's go get a walk?
That's a good one.
And so if we add some steps to our day, that will be little things that we can do to help.
Okay.
I have another colleague who's a physician, and she has a new baby, and she's busy, and what she does is she parks. Anytime she goes anywhere, she parks the farthest away that she can possibly park. So that she has to walk all the way up from the back of her parking lot to her office, to the back of the grocery store, to the front door, to try to get her steps in, and then she takes steps when she's in the hospital. She doesn't use elevators, and so this is stuff she's trying to incorporate into her regular busy day.
Right.
That she can get some steps of exercise in.
If you had any suggestion for a small dietary change that would make a big difference, rather than, if somebody feels overwhelmed about counting calories or trying to eat salads at every meal, what would you say would be the one thing, a small change that somebody could do dietarily?
So that's a hard question to answer because it's different for every person. It depends upon what your diet is. So I always tell people the first thing you want to do, even if you don't write down everything you eat every single day, pick 3 or 4 days out of your week and write down what you've eaten and take a look at what your issue might be. Because I find that some people overeat. They eat good things, but they eat too much of it.
Right.
Other people eat too much of something bad.
Okay.
And other people eat too much of one item that's good. So if you're someone who's eating 10 pieces of bread a day,
right,
you need to, the one thing that would help you is to cut back on your bread,
I see.
right? If you're someone who, eats, I eat lots of fruits and vegetables, and I have a big meal on breakfast, lunch, and dinner, but your plate is like this.
Right.
Then you're someone, the best thing you could do is give you another size plate and try to fill that plate instead.
Right.
So it's very individually sort of geared to try to figure out what one thing someone can do. I would say if you are trying to lose a large amount of weight, right? Studies have shown that people who are trying to lose, upwards 100, 150 pounds, really large amounts of weight, that you're probably going to need some additional assistance other than just your diet and exercise.
Okay.
And so you should probably see a physician to kind of help maneuver yourself through that through that trial. And it's not to say you can't lose weight on your
Right.
own, because you can and
Right.
you should, and you're going to have to no matter what avenue you choose to take, but you're probably going to need additional assistance if
Okay.
you want to do it in the next 3 to 5 years. So that group of people probably need to have additional help in addition to their diet and exercise.
Sounds good. Well, thank you so much. I really appreciate it. And you heard it here. Diet and exercise make a big difference.
Well, thank you. Thank you for having me. I
Thank you.
appreciate it.
It's wonderful.
Yeah.
Thank you.
I enjoy it. Thank you.
Thank you.